AI is all a rage. The artificial intelligence chatbots like ChatGPT are taking over the internet. So I wanted to ask ChatGPT, tell me all about prednisone side effects. What did it say? And I wanted to respond. What did ChatGPT get right about prednisone? And what did it get wrong? Hi, I'm Dr. Megan, your prednisone pharmacist, and I've been making videos about prednisone for almost 5 years now. And I just wanted to know, what does the artificial intelligence know about prednisone that I don't? Or what can I correct? So let's find out. So I asked, make me a blog post about prednisone side effects. And it ranked them in order of from 1 to 6. These are the top 6 prednisone side effects according to AI. First was increased risk of infection. One of the most common side effects of prednisone is a weakened immune system, which makes it difficult for the body to fend off viruses and other illnesses. This can increase the risk of developing an infection, including serious ones like pneumonia, while taking prednisone. Symptoms to look out for include fever, chills, sore throat, and extreme fatigue. So I agree that increased risk of infection is definitely a thing. And pneumonia is definitely the biggest one to be concerned about. But it's hard to say if the symptoms to look out for include fever, chills, sore throat, and extreme fatigue, because those are non-specific and not likely to actually diagnose pneumonia or the other infections that are more likely while on prednisone. You don't get more, for example, coughs and colds. What you do get more often are rare conditions that people like with HIV would be getting. I've got a whole video all about infections and prednisone that has gone pretty viral. And so you should check that one out to dispel some myths and maybe get some comfort in knowing what not to worry about. So that was their number 1. Number 2, they said, was digestive issues. Prednisone can cause gastrointestinal issues such as nausea, heartburn, stomach pain, bloating, indigestion, and cramping in some cases. Additionally, it has been known to cause changes in appetite, which may lead to weight gain or weight or loss. So digestive issues I learned about in pharmacy school as one of the main things to warn my patients about. And what has been the most fascinating thing to me is the lack of complaints that I get from people who actually take prednisone. People very rarely ever mention digestive issues. Almost no one ever says nausea or heartburn or stomach pain or bloating or indigestion, and definitely never do I ever hear of cramping. Those are just not prednisone side effects anyone ever mentions, even though that's what I was told to mention. That's why they told us to take it with food. Should you or shouldn't you? Watch my other video about that. But the part that they did get right was the weight gain. Weight gain is the number 1 side effect people complain about. 70% of people who take prednisone get weight gain. So I agree with that, but all of those first parts of it, I do not agree with. Number 3 says the AI chatbot, mood changes. Long-term use of prednisone can lead to mood changes due to its ability to alter levels of neurotransmitters in the brain. It has been linked with depression and as well as euphoria or high energy levels in some cases. Other symptoms may include restlessness, agitation, or insomnia. So what's my response to number 3? So I think with number 3 that yes, mood swings are very common when it comes to taking prednisone, and they're really surprising and nobody really ever mentions them. And some people even are like wondering if they're going crazy. So I have a whole video all about, am I crazy? And what can I do about it? It's not you, it's the drug. Remember that. And euphoria can be quite common, especially at the beginning of taking prednisone. And then the number 1 tweeted side effect that people aren't ashamed of mentioning, like there's a lot of, fat shaming in our culture. So people aren't willing to really mention the weight gain so much on Twitter, but everyone is willing to mention the insomnia on Twitter. So it's the number 1 thing tweeted about is the insomnia. So that is definitely a very common side effect to prednisone. All right, number 4, high blood pressure. And the chatbot says, high blood pressure is another common side effect of prednisone use and can be caused by fluid retention and increased blood sugar levels because of the steroid medication's effect on metabolism. If left untreated, this can lead to strokes or heart attacks, so it's important to get your blood pressure checked regularly while on prednisone. And I agree with this entire statement. The blood pressure changes on prednisone are very unappreciated, and some of the long-term irreversible side effects from prednisone are related to what's mentioned here, that it can cause strokes and heart attacks. I just barely got an email from someone this week saying, how can I get off prednisone? I was diagnosed with this rare, terrible heart condition because of the prednisone. Help me get off quickly. And so, yes, you need to do all you can to have a healthy lifestyle to keep your blood pressure intact as well as you can without other drastic measures. But if your blood pressure is high, you need to get care. You need to let your doctor know, I want to do whatever I can to support my blood pressure while on prednisone. They might prescribe medications, they might prescribe a diet, but you need to keep that under control. Number 5, says the AI chatbot, osteoporosis. Prednisone has an adverse effect on bone density over time, leading to osteoporosis if not managed properly. By talking with your doctor about calcium supplements or additional treatments for bone health maintenance when taking prednisone long-term, like most autoimmune disorders. So yes, prednisone does cause osteoporosis along with all other corticosteroid medications. And it's a terrible thing when your body is stealing from Peter, your bones, to pay Paul, which is counteracting your autoimmune condition or your inflammation or whatever you're taking the prednisone for. And so most people think, oh, my bones are just fine, or they're not even warned about the osteoporosis. And that's horrible. But the doctors who prescribe prednisone the most do recommend what it mentions here, to take calcium supplements or additional treatments for bone health maintenance, because this causes the most severe drug-induced osteoporosis of any drug. And people have not just osteoporosis, but they have bone fractures, hip fractures that 25% of the time can be fatal, that can cause you to have to be in a nursing home. It can lead to spinal compression fractures where your height shrinks because your bones compress upon themselves and you don't even know it's happening until one day you measure your height and you're suddenly shorter. So osteoporosis is something we have got to worry about. We have to be counteracting. And those doctors who prescribe prednisone the most, the rheumatologists, their guideline says to take if you're taking 2.5 milligrams of prednisone or more, you need to be taking calcium and vitamin D. And that is something that everyone needs to be doing unless your doctor tells you not to. You need to be taking calcium and vitamin D while on prednisone. And number 6, it's the chatbot says, skin reactions. Many people experience skin irritation when taking prednisone because this medication not only affects the body internally, but also externally, with the potential for rash, redness, or dermatitis, depending on individual sensitivity levels and dosage taken daily, weekly, etc. So if experiencing any abnormal itching, redness, consider talking with doctor about adjusting dose/schedule accordingly, ASAP, in order to avoid more serious skin reactions like hives due to allergic reaction caused by predicate steroids being prescribed at too high doses throughout long periods, months/years, without evaluations from healthcare professionals first. This I completely disagree with. The most inappropriate word is many people experience skin irritation. I'd say this is an incredibly rare side effect of prednisone. There are like 1 in 10,000, 1 in 100,000, 1 in a million chance that you get this kind of a reaction. No one ever mentions this. It's just not a thing that you would list as the top 6 side effects of prednisone. This one is just completely wrong. It can happen. but it is not something that many people experience. So sorry, AI chatbot, this is just wrong. Like number 6 is just completely wrong. Oh, it's just terrible. So if you are wondering what side effects am I actually most likely to experience, right? Then you should download my Prednisone Checklist. In it, I go through the top side effects that most people experience, but not just that, also how to counteract those side effects. I give tips for what ways you can counteract the side effects naturally without using other medications. And I talk about my experience and what I went through, what side effects I personally experienced, so that you can see what you might be going through too. And you can just download it by clicking the link below. I'm Dr. Megan, your prednisone pharmacist.